Robby, what is on your radar?
Well, the city of Washington, D.C. is moving forward with a requirement, unprecedented and essentially unique in all the country, that all kids ages 12 and older must be vaccinated for COVID-19 before returning to school this fall. The district's attitude is, quote, no shots, no school. Paul Kinn, D.C.'s deputy mayor for education, told the publication DCist last week that the city has, quote, every intention of following the law, and by that he means the city has every intention of forcing kids who are not vaccinated to miss more school. The city believes that more than 80% of kids in that category are already vaccinated, but that rate drops to just 60% of black students. In other words, students who are already disproportionately likely to have missed too much school or who are disproportionately likely to come from a disadvantaged economic background, well, they're a lot less likely to be vaccinated. Thus, we should make no mistake. A policy of enforcing COVID vaccinations for teenagers is a policy that will mean more black and brown kids missing out on school. Now, we talked about this on Rising last week, but it bears repeating. There is no legitimate scientific rationale for this policy. Otherwise, healthy young people are not at significant risk of a negative COVID health outcome. Most importantly, the vaccine is no longer a public health measure. It's a personal health decision. Vaccinated people can easily contract and transmit the virus. Breakthrough infections are now so common, we've ceased even calling them breakthrough infections. President Biden has been vaccinated, twice boosted, didn't stop him from getting the virus. COVID is super transmissible. Mitigation efforts can reduce your chances of contracting it to some degree, and the vaccine certainly helps at-risk people decrease their likelihood of severe disease and death, which is great, but the vaccine itself is just not offering any sort of reliable protection against infection. Against severe disease, yes. Against infection, no. The argument for vaccinating kids was supposed to be that even if the virus isn't so bad for them, well, they could spread it to a vulnerable member of the community, like a teacher or a janitor, etc. We vaccinate kids against a whole host of illnesses because we don't want outbreaks of disease in school environments. But look, the COVID vaccine doesn't work that way. It doesn't stop outbreaks of COVID. So the argument for mandating it is much weaker than the argument for mandating other vaccines that do stop transmission. Journalist David Zweig explained this expertly last week on our show. Let's watch.
Behind a mandate, we don't always or often mandate a medical product solely because of the purported benefit to the individual. The underlying reason why a school district would do it is to say, hey, we need you to have this thing done because you have an obligation to the community. But the vaccine isn't doing that to any degree on a large scale that would make sense, particularly so for children who've already been infected. I have not seen any data to show what the actual reduction is in severe disease or illness from a child being vaccinated versus a child who's healthy, who's already had COVID. We haven't seen any of that real world data yet.
Now, so far, D.C. is basically the only school district in the country to require vaccination for this age category, 12 and up. Los Angeles had planned to do so, but they gave up when they saw the actual vaccination rates for these teenagers. My fear, though, is that school districts could at any point move to require COVID vaccination. They might also require vaccination for kids even younger. So far, the vaccine only has emergency approval from the FDA for kids 5 and older, so districts can't really mandate that. But once the vaccine has general authorization for 5-year-olds, well, then I would expect D.C. at least to require it for them as well, and we don't know what other districts could do in the future. Now, again, to be clear, if you want to vaccinate your child, you should absolutely be able to do so. But if a different family makes a different choice, that's okay. Shouldn't matter to you. Doesn't put you or your family at an increased risk to any appreciable degree. Now, one thing I noticed when I was doing research for this radar and looking into school vaccination policies is that New York City, while not having a blanket mandate, actually has one of the most ridiculous policies I've ever encountered, at least on paper. I don't know what they're doing in terms of enforcement. But New York City is not requiring the vaccine for all students. It is requiring the vaccine for students who play sports or participate in certain, quote, high-risk extracurricular activities. All DOE students, this is quoting from the New York City's health website, all DOE students and staff who participate in high-risk sports or competitive after-school sports must be vaccinated against COVID-19. Fully vaccinated means at least 2 weeks have passed after an individual received a single dose of a vaccine that requires only 1 dose or the second dose in a 2-dose series, one that's authorized by the FDA, et cetera, or the World Health Organization. A COVID-19 vaccination requirement also applies to students participating in high-risk after-school extracurricular activities like chorus, musical theater, dance team, band, orchestra, with special concern for woodwinds, marching band, cheerleading, flag team, etc. Students ages 5 and up must be vaccinated in order to participate in these extracurricular activities. So New York City isn't requiring students generally to get vaccinated, but all students 5 years and up will be forced to get jabbed in order to join the band or play a sport or do all sorts of things. Now, note the policy's language was high risk. What the city means, of course, is that it believes these are activities in which there's a high likelihood of COVID spreading: contact sports, playing a musical instrument, etc. Look, we all know by now that COVID is easily spread in all sorts of circumstances, and it's worth repeating, the vaccine does not proactively block the spread of COVID in these environments. If members of the marching band and the cheerleading squad are at a high risk of contracting the virus, that risk is not actually reduced meaningfully by vaccination. The severity of the disease might be reduced for the person who contracts it, though again, it's hard to see statistical improvements in this age category given how non-threatening COVID frankly is for the vast majority of kids. We do not want elementary, middle school, and high schoolers in our cities avoiding getting involved with sports and bands and teams because they're unvaccinated. Extracurricular activities are stabilizing forces for many kids. For at-risk youth, being involved in school groups makes them much less likely to engage in antisocial behavior, fall in with the wrong crowd, things like that. We want our kids in school. We want them to participate in a school-linked activity that they enjoy. That's how we create productive, socially well-adjusted young people. Accomplishing this is a compelling public health goal. New York City and the District of Columbia are risking undermining it for no good reason, certainly not for anyone's health. It puts the health of our entire society at risk, Batya, is my fear. The things we're doing just make no sense. And so we had talked about what DC is doing on the show last week, but you're in New York, so I don't know if you were aware of this. I hadn't looked closely enough at what New York's policy was going to be. That's a 5 and older policy. Maybe they're not enforcing it, but that's what it says. 5 and older policy to participate in all sorts of extracurricular activities that you want, but you want kids to do those things. They deserve to do those things. Whether they're vaccinated or not makes no difference, none whatsoever, to the public health situation in these schools.
It's unbelievable. I mean, I remember, right after the vaccine came out, 5 months later, something like that, when they made that mandate to enter restaurants, and suddenly Black friends of mine were telling me that they were being turned away from restaurants in blue cities in 2021. I mean, it's appalling. Now, Black children are going to be, just like you said, turned away from schools. Black children are going to be turned away from extracurricular activities. What are we doing here? And, Robby, I wanted to ask you because I'm so glad that you keep your finger on this and you keep pressing this. What is your explanation for why? Why are they doing this? Why can't they see how terrible this is, from a racial equity point of view, which they claim to be, like that is their number one issue?
Yes.
Why are they doing this?
It's some kind of delusion. It's some kind of tribal. This is the best I can tell. You have to be, if you're a good thinking, pro-science, Team Blue member, you have to be not just for vaccination, because I am for vaccination. I've said that I think there are significant benefits of vaccination for many populations, for at-risk people, for elderly people, and that I think the vaccine should. I don't like when the FDA drags its feet on this stuff. I absolutely think I would have moved faster on allowing families to vaccinate their kids if they want to. So it's not, to my mind, when we talked to David Zweig last week, he said the same thing, that it's not like, it's crazy to call him anti-vaccine. All he's saying is that there's no rationale to require this and then to punish kids who don't get it by making their lives even worse. Their lives have been miserable already. Can you imagine being a young person going, the young people that I know, I have nieces and nephews, I have kids of family friends, those kinds of things. I guess I don't actually know a lot of young people in their teenage years where they're probably most affected by the social distortions. It's got to be miserable. I mean, you can see from the mental health, the illness surveys, how much worse things have gotten for them. But we're going to keep doing it. We're going to keep stigmatizing the unvaccinated, even though they're not providing any Right, there's not some conflict of values where we have to decide, well, on the one hand, we want to give you this autonomy and let it be a personal decision, but on the other hand, we feel like we have to compel you to do this so we can keep transmission rates down in the school. No one is making the argument that requiring vaccination is corresponding with keeping the transmission rates down. No one is bothering you don't hear that argument even from the most kind of adamantly, team blue, team science people, because they know it's not true.
And it just really reinforces the vast gap between what they call, quote unquote, the science, and then what they do in terms of their policy, like how big that gap is. And then they question why they have no authority and no moral authority, no scientific authority, why Americans no longer trust these institutions. I mean, this is why.
This is why. The vast loss of trust corresponding to these just absurd mandates, which I will be continuing to follow, but I can't wait to find out, Batya, what's on your radar, and that will be coming up right after this.